Welcome to Solutions IRB presentation on what level of review is my study. We commonly have PIs ask us what level of review their study will be. And when we make a determination, we consider a number of factors. First of all, what category does it fit? Does it fit any of the exempt or expedited categories? Who are the subjects in the study? Normal, healthy adults? Are they individuals with specific illnesses? Are they children? Are they prisoners? Are they pregnant women? And also, what is being done to them in the study, or what are they doing? And this ranges the gamut from medical procedures, collection of blood, to taking of surveys and answering questions or doing small tasks. First of all, we'll look at the exempt and expedited categories. The Code of Federal Regulations outlines these in detail. And if your research fits into one of these categories, this can tell you what level of review it is. Here are the exempt categories in brief. I encourage you to go to 45 CFR 46104 and look at each of these categories in greater detail, because there is more explanation and there are some caveats. So the first is research conducted in commonly accepted educational settings involving normal educational practices. Exempt category 2, research involving educational tests, surveys, interviews, and observation of public behavior. So you'll notice that they mention educational tests here. These are outside of educational settings. Exempt category 3, research involving benign behavioral interventions, such as having subjects learn something in a computer game. Category 4, research that involves secondary data. So the data has already been collected and it is going to be analyzed in a different way. Category 5, research examining public benefits programs. Category 6, taste and food quality evaluation. Category 7, storage and maintenance for secondary research. And category 8, secondary research for which broad consent is required. So of course, in the CFR, there will be more information on, for example, what broad consent is, what type of food can be involved in the taste and food quality evaluation, and so forth. Exemptions may apply to individuals who are classed as vulnerable populations. Vulnerable populations are discussed in subparts B, C, and D, and they may be involved in exempt research in certain instances. So for subpart B subjects, pregnant women, fetuses, neonates, they can be involved in exempt studies if the conditions for exemption are met. Subpart C, which pertains to prisoners, prisoners can only be involved in research if they are involved incidentally. So it's not targeting prisoners, but an individual who is a prisoner, or maybe who becomes a prisoner, happens to be part of the population, but it's not specifically targeting inmates. Subpart D, which pertains to children, they can only be involved in exempt categories 1, 4, 5, 6, 7, and 8. Your research may also fall into an expedited category. These studies receive a higher level of scrutiny than exempt, but not as thorough as a full board study. So clinical studies of drugs and medical devices under specific conditions, collection of small blood samples by specific means, prospective collection of biological specimens for research purposes by non-invasive means, collection of clinical data through non-invasive procedures, research involving materials that have been collected or will be collected solely for non-research purposes, collection of data from voice, video, digital, or image recordings made for research purposes, research on individual or group characteristics, continuing review of previously approved studies, and continuing review of research where categories 2 through 8 here do not apply. And finally, we take into consideration what is being done to the subjects and what the subjects themselves are doing. So a few things that might move a study to a higher level of review, the more invasive and intrusive the study activities are. So for example, collection of a lot of blood, having the individual even give a normal amount of blood, but more frequently. Any activity that raises the level of risk in the study. So even something like having them exercise can raise the level of risk. If private information is being collected and kept, depending on what that information is, how it's being stored, and what the topic of the research has to do. So what is their private information being linked to? And also, is the subject being exposed to more risk than in their normal daily lives? So risk looks different for, the average person walking down the street than it does for a terminally ill patient. This doesn't mean that, we can just do anything we want to terminally ill patients. However, a study can involve procedures that wouldn't be acceptable for a normal healthy individual, because in many cases that subject, that could be their only means of perhaps receiving care, or receiving comfort. So we do take into consideration the type of risk that that individual is being exposed to as a matter of course. Questions? Please contact us at reviews@solutionsirb.com or phone us at 855-226-4472. Thank you.